Well, I'm Dr. Gireesh, physician, neurophysician, and neurosurgeon. I'm now addressing to you the part 6 of continuing medical education program, which has been organized jointly by Padma Clinic and Nursing Home, Chennai, and the Lions Club of Madras Excellence, Lions Club Madras International, District 324A5. The topic which I'm going to address today is on healthy aging and aging gracefully. The United Nations has declared 2021-2030 as a decade of healthy aging. It is a global collaboration aligned with the last 10 years of the Sustainable Development Goals that bring together governments, civil society, international agencies, professionals, academia, the media, and the private sector to improve the lives of the elderly people, their families, and the communities in which they live. WHO defines healthy aging as a process of developing and maintaining the functional ability that enables well-being in older age. Functional ability is about having the capabilities that enable all people to be and do what they have reason to value. In 2019, it is estimated that people aged 60 years and older was 1 billion. That had been the estimation. And this will increase to 2.1 billion by 2050. Senior Citizen General Assembly designated October 1st the International Day for Older Persons by resolution on 14 December 1990. Now, all this, in fact, goes to prove and show how much the aging population will have got to be looked after and cared. Like childhood and youth, elderly age is just another phase in man's life. Aging is unavoidable. The law of nature, and that's the law of nature. It changes, and changes occur in the aging body, and that's bound to occur. Some of the changes that occur in certain systems of the body, we'll just have a small glimpse. The nervous system, brain, which weighs that much, 7 to 10%, there is a loss by the time the person is aged 90 years. CT scan also shows aging changes starting around 50 years. There is cell loss in layers of 2 and 4 of the cerebral cortex. There is a 50% loss in macular portion of the visual cortex. That's the back of the brain. Loss of dendrite branches, and also further cell loss have been noticed in putamen and substantia nigra. Certain changes in the bone can occur. Degenerative changes as age advances. Here you see the cervical spine, that's the neck. And here you see some degenerative changes that are occurring as age advances. This is the low back. You find degenerative changes are seen. You can see spikes in the front as well as the back of the bone. And disc between the two bones can get degenerated, because the whole body weight is coming over to the low back and then goes to the lower limbs. As age advances, there can be a shortened sleep cycle, flattening of mood, decrease in motor activity, reduction in cognitive ability, and there can be a reduction in memory too. As far as tongue is concerned, there will be a reduction in the number of taste buds. And parietal lobe, which is situated on the lateral side, which would have lost controlling the taste sensations. There's a slight slackening. And there'll be a decline in the taste of food. Mouth, secretion of saliva is decreased, and there'll be a dryness of the mouth. Stomach, acid secretion is reduced, and they are prone to developing ulcers. Small intestines, the blood flow will be low and less than 50%. Ability to absorb nutrients slowly declines. Movements of the large intestine are decreased, and one can develop constipation. There can be slowly a sluggish function of the liver and kidney, and gradual enlargement of the prostate in the male. And in the females, there'll be weakening of pelvic floor, with some having stress incontinence of urine. These are some of the changes that can occur. Now, moderating lifestyle, one can avoid these deleterious life risks. Large studies have shown that the use of clean water, pure air, good nutrition, balanced diet, adequate exercise, rest, sleep, regularity of life function, a positive mental attitude, moderation in most activities, never smoked, and normal body weight, they could increase their longevity in a healthy fashion by around 11 years longer. Very, very important. Thus, aging process, ladies and gentlemen, is inevitable. Adhering to certain qualities in life can make it a very smooth process. An elderly can age in a very elegant and graceful manner. To adopt a very good healthy pattern by senior citizens, to enjoy an excellent longevity of lives, I'm just addressing 21 points. There are indeed 21 points which I'm going to tell you now for a healthy aging. And that can be incorporated into your lovely schedule of the day. Very important. And these are all practical points. So I'm going to tell you now the 21 practical points for a healthy aging, which can be incorporated into a lovely schedule of yours. 1. When you get up in the morning from bed, please sit and steady yourself before you stand and then walk around. Because beyond the age of 55, 60, you find many of the aging people will be taking some form of antihypertensives or antidiabetics, and they can have autonomic imbalance. Therefore, when you get up in the morning from bed, please sit and steady yourself before you stand and then walk around. 2, when you get up in the morning, please do drink a glass of warm water. 3rd, clean up your bed. This will be a very good exercise for your hand and elbows, doing it by yourself. Brush your teeth well and then gargle with the warm water. Now, why should you gargle? As you see here, the midsection of the head and neck will show you, the arrow shows this is the nose. You find over the night some secretions will slowly come down to your throat and remain there. And that can produce infection in the throat. That is why it is advisable to gargle with a little warm water and then spit it out. You find your throat gets very clear and you may not get a sore throat. Therefore, brush your teeth well and then gargle. 5. Complete. You can go to the restroom, complete your toilet habits, but when you walk into the bathroom, be very careful so that you may not slip and fall. Lighting is very essential, and the flooring, there should be anti-skid tires. And always when you sit, before sitting onto the commode, you please hold on to the grab bar handle on the side as seen in the picture. Once that's all over, take a cup of coffee or tea, whichever you prefer. Please sit very relaxed and drink. Have 1 or 2 biscuits along with the first drink. 7. Please do develop the habit of walking for 1 hour. When I say 1 hour, it doesn't mean you have to continuously walk for 1 hour. Walk for about 5 or 10 minutes, take a little pause, and then again you can start your walking. Be relaxed, be comfortable. You can walk even in your room with the windows open, or the terrace, or the park nearby. Keep yourself at ease when you go for walking. Wear loose dress, comfortable, like pants, shirts, bermudas, bunian, up shorts, dhoti for the men, and for ladies, saris, salwar, loose bunian, pants and wear. And also, please do wear a pair of slip-on shoes or chappals, whichever gives comfort for you. Extremely important. And those who are diabetics, please see that you buy a diabetic shoes, which will be specially fit so that the pressure is uniformly transferred in your foot or other feet. And all aging people, this is an advice. Whenever you climb up the stairs or descend down the stairs, always hold on to the railing. Very, very important. Sometimes when you hurriedly climb up, you might feel giddy and you might miss one step and you will have a fall. Very important. And also, when aged people, when they walk, if essential, if you feel there is an imbalance, unsteady, you can use a walking stick, 3-legged or 4-legged. For some, it gives more confidence. Walk slowly and steadily. If tired, take rest and then walk again, or else discontinue. If you feel there is some discomfort, you can always discontinue. Prior to walking, it's nice if you can just stretch out your body and see that all parts of your body and joints are a little more stretched. Do the mild stretching exercises, which you can learn from a good physiotherapist. Walking is a relaxing exercise, both mentally and physically. As you walk, hear the music or observe the nature, the natural surroundings, and enjoy. One other important thing beyond the age of 60, 65, when you walk and when you have your phone or your hearing onto your music, kindly listen to yesteryear songs like those which I've heard during your school days, college days, your middle age, and you will really find as you're hearing those songs, you'll be recalling all the golden memories of your childhood as well as your adulthood. That in fact is a very, very relaxing feel. So walking is a relaxing exercise, both mentally and physically. As you walk, hear music or observe the natural surrounding. 11. After finishing the walking, sit down, relax, can do a little of stretching with the hands and legs, and wipe out the sweat that will be on your neck, head, and your back of the head with a towel. 12. Have a warm water bath as per your pattern, after which you wear fresh clothes. Now, when I say as per your pattern, it means some are used to taking cold water bath and they may not have any issues. So they can actually continue that. Otherwise, take a small warm water bath and after which you can wear fresh new clothes. Skin hygiene is very, very important as age advances. 13. After taking a good bath, you can sit down, have a breakfast with either fruits, cereals or milk, or idli, or dosha, or roti, or it can even be grain bread with grainy bread, etc. And then take your medications, what you got to take before or what you got to take after. See that your medications are being taken. Once after your breakfast, everything is over. The 14th, pray to God that the day should be peaceful, calm, and satisfactory. You can also hear to devotional songs if you like, especially it is quite soothing and it will calm the mind. Think positively and make the day happy for you by doing work which you like. Very, very important. Have a cheerful outlook, and you can say it is in your life, it is in your hands to make that particular day very active and very lively. Have a favorite hobby if you want to. You can do any one of them. Hearing music is one activity. Reading books and newspapers, watching TV, or talking to somebody over the phone. Yes, very good. Talking to yourself, gardening. It's a good exercise. It is very relaxing to the mind too, to see the greenery around. Watching the fish gliding in the water, swimming. And if you have a nice, lovely music in the background and seeing the fish gliding, it makes this lot of soothing effect to the mind. You can even feed the fish, or else playing with the dog if you have one. A little bit of time you can allot yourself for a little cleaning activity of your room or your home, some part. It's again some sort of a little exercise which keeps your joints all engaged and it will not get frozen. Play with your grandchildren. It's a must, and it is very important that all juniors respect the seniors. Extremely important. And the seniors, in turn, should in fact motivate the juniors and never discourage or say anything negative that hurts the feelings of the juniors. You can also do computer browsing or visiting someone, playing cards, writing letters. You can even undergo some online training courses. There's a galore of such courses now. Certificate courses are available which suits your mind, your liking, your spirituality. You can do it. On a weekend, maybe going out to see a drama or movie or visit to a beach. Always, I would advise above 60, have your identity card wherever you go or whenever you go out. This is yet another activity which is the social connectivity, doing service to the needy. Connecting with other people is a stress reliever. Focus just not on yourself, but also help others. You call that as, a eudaimonic life, a eudaimonic lifestyle. That is a life rich in compassion and altruism. Compassion means a desire to help. Altruism means you are considering others above us. That's very, very important. Eat good, nutritious food for a healthy life and for a healthy aging. See that cereals like wheat, green gram, ragi, cholam, etc. used in your diet. Take vegetables in plenty with less rice. Try to eat fruits also in the daily diet. Minimize chili, salt, sweet. Excess of these will create problems. You can take your food as per your dietitian or nutritionist advice. Constipation is a common problem in aging. So food high in fiber content is very, very helpful. There is an old saying that an apple a day keeps a doctor away. It's very, very true. Apple with the skin. If you're taking one apple soon after your breakfast, I can assure you that you will not have constipation the next day morning. So therefore, And when you eat such apple, please see that there can be insecticide spray, there can be wax coating sometimes. Therefore, please do wash the apple very well. Even you can scrub it with a small brush. That you're about to do it by yourself. Very important, so that there are no preservatives on that. And it's very, very safe to eat it, except for diabetics. You can have half an apple. Try to drink 6 to 8 glasses of water daily. When I say water, just not only plain water, it includes a cup of milk, a cup of soup, a cup of fruit juice, and so on. Please avoid fried, spicy, and fatty foods for your satisfaction. Once or twice, you can take it in a week, but it should not be taken just for the sake of taste. Try to develop to take plenty of fluids unless you have a cardiac or renal problem. Then it goes by the advice of the dietitian as well as by the consultant. Loss of teeth with advancing age creates several dental problems since chewing becomes little difficult. Therefore, soft cooked foods or mashed food is very much preferred. What happens is, as age advances, you will find there will be a malalignment of the teeth. And because of that, you find one may be worn off a little more than the other. So when you eat hard, crispy foods, you find suddenly you develop severe pain. This big masseter muscles, the jaw muscles, starts having acute pain. It will be unbearable. Then you will have to rush to the dentist where they will polish off the non-maligned teeth. So therefore, chewing becomes a little difficult. So eat soft, cooked food or mashed food, and that is being preferred. Smoking, ladies and gentlemen, can in fact produce lung cancer, chronic bronchitis, cancer of throat, mouth, cancer of blood, cataract, stomach ulcer, bad breath, and whatnot. If any one of you, those who are hearing this particular lecture, if it's smoking, please do quit smoking now. 17, have a positive attitude. Always remember, don't brood over the past. So what we have is only the present. Live and enjoy your present day. It will mentally make you very happy. Try to adopt a discipline in your daily routine, as has been narrated now. Even if you do not have it, even if you're not having practicing it before, please do start practicing that. Try to inculcate the habit of appreciating and complimenting others. It will lighten your heart also, because they'll also be happy, you'll also be happy. Develop being cool and cheerful always. Engage and enrich yourself by doing certain activities which you like. Reading is a very good activity. And I can tell you, there is nothing like the book. Book is the best companion for anyone. And one can never feel lonely at all if you have that habit. Otherwise, try to practice whichever habit, what you like and what makes you comfortable. Very important. Remember, negative qualities like mental tension, anxiety, worry will affect one's health and shorten your life duration. Never have the feeling that I am old and I cannot do anything. Just don't think like that. I'm sorry about it. I can do, I'm able, I'm a capable person. I will look after myself. I'm quite a healthy individual. In that manner, you're going to move forward. You have a crown on your head. That is a privilege of being a grandparent. Enjoy that status. Have contentment, that is satisfaction in whatever you have achieved so far. Always discard the negative feelings. This will help to forget the past ill feelings and help to invoke a sort of happiness, a sense of happiness within you. You can also make devotional commitment and lean towards spirituality. This is very vital as age advances. It gives you a good peace of mind. Once in 6 months or a year, have a medical checkup and consult your family doctor. 19, age-related problems have specific treatment, so do not feel worried. Very important. Have checkup immediately when you find any one of these symptoms as narrated in this slide. A loss of weight, altered bowel or bladder habits, all of a sudden, blood in sputum, nagging cough or a change of voice, difficulty in swallowing, continuous or intermittent fever, chronic pain in any part of the body, change in color of the skin or enlargement of a mole, a lump in the breast, bleeding, a disorder or a discharge if there is. So any one of these which you develop beyond the age of 60, 65, I think you must have a medical checkup immediately. And you can in fact take a rest after the lunch. Avoid afternoon nap if it disturbs your night's sleep. Please take supper at 7:30 p.m. and go to bed by around 10:30 or 11 p.m. Now, why do I say to take supper at 7:30 p.m.? Why that early? Because it takes already after eating food, it takes almost 3 hours for the stomach to get emptied. Therefore, and then only you will get a very good sleep. So if you take your food by around 7 or 7:30, you find 3 hours. By 10 or 10:30, your stomach would have got empty. And when you go to sleep, automatically you'll get a very, very good sleep. Have a good sleep for about 6 to 7 or rather 8 hours. Happiness is within us. Enjoy every moment of your life. For life is a beautiful gift of God. When the day ends, thank God Almighty for giving such a peaceful day, and you will blend with a beautiful tomorrow. There are some common characteristics of good adjustment for healthy aging, and that's the last 21. Economic independence, yes. Maintaining social contact with people of all ages. Participation in community organizations. Ability to maintain the household activities without much physical effort. Be contented with what one has. Very, very, very important. Extremely important. Enjoying the present without regretting the past. Minimum worry about self or others. Enjoyment of the day-to-day activities. Avoidance of criticizing the younger generation. Don't start blaming them. Avoidance of fault finding. Keep strong and fulfill your unfulfilled desire. There might be some small desires which you are about to fulfill. So keep strong, keep your mind strong and fulfill those unfulfilled desires. Have moderate exercise based upon your health. Eat a balanced diet. A balanced diet consisting of carbohydrate, protein, fats, vitamins, and minerals. If you're a diabetic, hear the advice of your diabetologist and your dietitian. Have adequate sleep, 6 to 8 hours of good sleep, and think positively. Well, a call to the aging people. Awake, arise, and act with happiness to pass through the inevitable track of aging and thereby age in a very graceful manner. For aged people are a treasure of the society. That's indeed, ladies and gentlemen, on the 21 points to have a healthy aging, or rather aging gracefully. Thank you very much.